I'm Marcus Shadini. I'm an orthopedic trauma surgeon at the Shock Trauma Center here at the University of Maryland, and I was in the first deployment to Haiti back at the end of January, beginning of February, along with Dr. Scalia, Jake Smith, Linda Getz, and the preliminary sort of team on the ground there. So when we arrived there, we first got to the hospital St. Francois de Sales. It was sort of clinging to a level of functionality. There were patients there in the courtyard under tarps and in tents. There had been some orthopedic surgical procedures performed by some international teams that had come for a week or so and left, and then there were a lot of patients that were still in traction, sort of in makeshift traction, and some of them actually had some skeletal traction pins in place, and then there were others that were just in sort of splints, makeshift splints with various dressings on extremities with no idea really what was underneath these dressings. So we kind of walked in, and it was our first task was to go through the hospital and figure out of what was left standing, what we could actually make into functional operating rooms and allow us to do some of the things we expected to have to do. And then after that, we went through and rounded on every patient in the hospital, took down dressings that it became pretty clear hadn't been changed in 3 weeks since the earthquake, identified some open fractures that had been neglected, identified some wounds that needed attention, and looked at all the x-rays on patients that had them and identified the fractures that needed to be stabilized and converted from traction to external fixation or some other form of stabilization. So it was really kind of, it was, as a member of the first team, it was a little daunting to see where things were and look at the amount of work that needed to be done and sort of trying to figure out where to start. But after the first day or so, after we had kind of inventoried the patients and gotten a feel for what their medical conditions were, gotten the operating room sort of up to a functional level, and then also sort of inventoried our own supplies and figured out what we had a capability of doing, you know, pretty quickly within the first 24 hours of being there, we were doing surgical procedures and getting patients to a higher level of mobility and functionality. The biggest impression made on me was by the people themselves, the patients, their absolute stoicism and resiliency. Not only the patients in the hospital, but just people on the street. You would drive through Port-au-Prince, and it was just utter devastation everywhere. Yet 3 weeks after the earthquake, when we arrived, things were already coming back to life. People had returned to the city. There was commerce on the street. People were laying out their wares and their fruits and vegetables, and basically going about their business as best they could. And in the hospital itself, the patients were very patient. They were not, after laying in traction for 3 weeks with a femur fracture, they were just grateful to have folks showing up there offering them an alternative and taking care of them. So they were very, very, very grateful and just extremely stoic in terms of their, never complaining of pain or any other issues. Did everything we asked of them after we would fix their fractures, ask them to get out of bed, we'd give them some assistance, and they would get up and get moving. So that was one of the most impressive things for me. The other was just seeing how our team, the people that from the University of Maryland that went down there with me and then came sort of in a second wave a few days later, just seeing how everybody stepped it up, did whatever needed to be done, and not saying, well, I'm a doctor, that's not my job, or I'm a nurse, that's not my job. It was like, what can I do to help? What situation right now requires, a pair of hands and some assistance. So everybody pitched in and did what needed to be done to get things up and running and take care of these people in a situation that was obviously far from ideal. I think one of the strongest and one of the things I'm proudest of the University of Maryland project in Haiti is our long-term commitment to not only taking care of disaster victims in the acute setting, but helping staying for at least 6 months in this hospital, providing follow-up care and rehabilitation and revision surgeries if necessary for the patients that we've already instituted care on. We've also sort of established ourselves as a consistent presence there, so that as other international and states teams from the United States are pulling up stakes and coming back home, they're referring their patients to our hospital for follow-up. So we're seeing more and more patients from all over Port-au-Prince and all over Haiti finding their way to our hospital because they know that our team is there and is going to be there. And even beyond the 6-month commitment that we've made for a clinical presence there, we're working on plans to transition it to a education program for the Haitian healthcare providers so that we can then transition the care of these patients back into the Haitian healthcare system, but to provide training and education so that it can be effective and seamless and allow them to then take ownership of their own care, which I think is, in the long term, probably the most important aspect of the whole project. It was an extremely rewarding experience. The first impression was, oh my God, what can we possibly accomplish here? But even during the first day, we started to kind of get our hands around the problems, get a feel for the situation, construct a plan that we felt would work, and it's been just incredibly rewarding for me to hear the stories of the teams that have followed us and built on what we started, and the progress that's been made, and the level of care that has just gone up and up and up with every single week and every team that's gone down there, with each team building on the last to create an even more functional hospital and administration of health care. So it was an extremely rewarding experience overall. It continues to be, and I'm looking forward to a return trip probably at the beginning of April. I would encourage everybody in the medical center to do anything they can to help, whether it's donating vacation time, actually participating in one of the teams, or covering for your colleagues who are down there. It is a worthwhile mission. It's a very worthwhile project. I think it's the kind of thing that we all are in the healthcare business for in the first place. This is why we do what we do. So, I just encourage everybody to get involved in whatever way that they can.